Okay friends, almost towards the last lecture in electrical stimulation and the parameters of electrical stimulation. Again, these are adapted from the latest book because I do not want you to end up into clutches that where have you read and from where did you get this information. So again, the source of this information is also 12th edition of Clayton's Electrotherapy, edited by Tim Watson, which is the evidence-based electrotherapy textbook, right? So you can even quote this if somebody asks from where have you got this data. So what should be the parameters of electrical stimulation, right? The parameters include number one, the intensity of current. So the intensity of current is as much current as the patient could tolerate, right? You are not going to tell the patient that it's okay, you can take more current, let me see the movement. No. The patient, as he gets accustomed to the stimulation, he will allow you to stimulate up to a level where you can see the movement. So the intensity of current starts from as far as the patient can tolerate and goes towards the functional movement. So once the patient starts tolerating, you can increase it up to a level where you can see a functional movement in the part, right? So this is what is about intensity. Pulse duration, as we had already discussed, that we start with the maximum pulse duration. So that is either the 100 or 300 millisecond intermittent galvanic, right? So that it is comfortable and it uses minimum intensities. So the patient is not intimidated. The patient doesn't get fearful about electrical stimulation. And we start with a lower current and gradually increase the current as the patient starts getting accommodated to the current, right? Duty cycle. Now this is one thing which we normally forget. Normally what people do, that there is an on and off time. See, we are going to keep it intermittent. So there is an on time and an off time. You have to keep the rest time in between so that the muscle doesn't get fatigued, right? Because if the muscle will get fatigued, the quality of contraction will lower. We know this by the virtue of our knowledge about muscle and nerve physiology, that the more the working of the muscle, the more the fatigue, and the more the fatigue, the less is the efficacy of contraction. So please remember that the on and off time should be 2 seconds to 10 seconds initially. That means the stimulation time is 2 seconds and the rest time is 10 seconds. This is ultimate and has to be used so that the patient remains comfortable and the muscle doesn't get fatigued, and you will get the best contraction that we can get by the use of electrical stimulation. It can be progressed to 5 to 15. That is 5 seconds of contraction time and 15 seconds of rest time. This is very important. Do not keep the rest time low so that you can finish the treatment fast. Many a times, because we are in a hurry to free the patient, we tend to put this and we give the contraction and we finish the patient and we send him off. But this is very important that you have to maintain this, and when you are giving stimulation, you are sitting with the patient at all point of times. You are not leaving the patient unattended. This is very important. Then what type of contraction? As I said previously also, that initially we are going to start with the isometric type of contraction where we do not intend to see the movement. We just want to get the contraction of the neuromuscular unit that can be seen, or that will be the minimum visible contraction or minimum palpable contraction, whatever as tolerated by the patient. Now some patients can be fearful, some can be in a phobia of current, some can be afraid of the current, and some patients will be there who will tell you to go for full intensities. So it depends on you, that you measure the type of contraction that we are getting, and based on that you are going to decide the type of contraction that we are going to elicit from the patient with the use of electrical stimulation, right? Now, what are the number of contractions per session? Number of contractions per sessions. So officially they say that it can be 10 to 20 with maximum intensity tolerable. 10 to 20 contractions with maximum intensity tolerable, and you can go for 2 to 3 sessions of this in a day, right? or if the patient is coming to you at the same time, then you can go for 10 to 20 contractions, right, with maximum tolerability. Then you have to give a rest phase and you can go for 2 cycles of this 10 to 20 contractions, 2 to 3 cycles, right. Please take care that the muscle is not getting fatigued, the quality of movement is not deteriorating, because if it will deteriorate, then we are not going to get the desired results, right. And what is the frequency of sessions? It is 3 to 7, that is alternate day thrice a week to 7 days a week. Even if you go for 3 alternate day thrice a week, or you go for 7 per week, depending on patient's convenience, on your convenience, on your workload, on patient's workload, you can decide this. It has a little bit of variation in this frequency, but it doesn't make a lot of difference. So the minimum bare essential frequency is 3 times per week, 2 to 3 sessions of 10 to 20 contractions with maximum tolerable current in each session. So this is very important, right. So these are the parameters how you are going to treat the patient. Now the last part in this is the contraindications, right. Now contraindications in muscle stimulation are 2. Then one are the general contraindications. So if there are pacemakers, we have to be aware, we have to get a consent from the patient and the doctor before giving the treatment. Then peripheral vascular diseases, if the patient is compromised in circulation, then also you have to take care before giving stimulation, right, because stimulation causes an increase in circulation, right. Obese tissue, so if there is a lot of adipose tissue, fat collection, and you are going to give current, the fat is working as an insulator, so you will not get a very good stimulation. So if you are giving it in obese patient or adipose area where there is a lot of adipose tissue, you have to be careful. Then neoplasms, definitely if you feel that there is a tumor or there is a type of malignant or non-malignant tumor available over there, then you have to take care, right. Then the skin, you have to see if there is no active infection or inflammation in the skin, so take care that there are no active infections or inflammations as far as skin and the local area is concerned. And cognitive problems have to be, the patient should be able to tell you that he is feeling the current, or if there are cognitive problems, if the patient is having a neurological condition that is not allowing him to communicate with you, then you have to be careful, and that is also a contraindication, because in that case, if you give him more current, or if the patient is not conscious enough, or he is not comprehensive enough, he is not talking to you, he will not be able to inform you that what is going on when the current is applied. This may lead to certain types of problems or local burns. So avoiding cognitive dysfunction. Now locally what you have to take care is, you don't have to apply it on the carotid sinuses, on thorax. In a pregnant lady you don't apply it on the trunk, and you don't apply it on the phrenic nerve. So these areas have to be avoided as far as possible. The last thing, the point of precaution over here is, number 1, chemical burns. So if you leave the patient with the electrode and you turn on the machine and you go to see another patient in your own vicinity, so this particular patient will complain you that I am feeling a burning sensation, and you say that this is a normal sensation, it's okay. This might lead to a chemical burn because of current concentration or electrode touching to the patient or the lead touching to the patient. So please take care that you are not ending up into chemical burn, and utmost care should be taken with electric shock. So many a times it so happens that suddenly the voltage fluctuates or the current goes off, and with this fluctuation of voltage, the stabilizer in the machine sometimes fail. The patient can end up in a shock. So if you are not with the patient, do not turn on the machine, and whenever you are moving away from the patient, keep the intensity 0. And even before changing each point of stimulation, if you are stimulating a whole nerve and there are muscles in the nerve, you are stimulating each nerve, you are going for individual muscle stimulation, you have to turn off the intensity each time the electrode comes up from the skin of the patient, right? If you are going to give a long-term stimulation to the muscles, then you can go for 2 pad electrodes, placing them on the both the musculotendinous junction of the muscle, and give a contraction to the whole muscle belly in cases of denervated muscles. But when you are going for motor point stimulation, that is the neuromuscular junction stimulation or the functional electrical stimulation, in that particular case you should not keep the intensity on. Even if the patient is comfortable, do not keep the intensity on. Each time the electrode goes away from the patient's skin, the intensity should go off. Please take care that the skin is wet and the skin is completely hydrated, so that to reduce the resistance, to avoid any chances of dry electrical burns that can be caused if the current is not transferring from the electrode to the skin effectively. With this, we come to an end of this topic of electrical stimulation. Right? Next, we will in next class we'll discuss about TENS, the mechanism of TENS, the types of TENS, and the indications of TENS, and followed by interferential current, and then I'll take a short lecture on all the other types of currents that are available that we use for stimulation for various purposes. So till then, take care, bye bye. Complete the topic and attend the questions that I forward you after the completion of this particular lecture. So have a great learning, have a great time, keep on revising the lectures, keep on referring books as you read this, and enjoy yourself. Take care, bye bye.